Good evening. Epidemiology has always been a field of interest to me. As a director of nursing and nursing and rehabilitation center, I have seen firsthand the perpetual cycle of ineffective or absent public health policies and patients in the grips of many avoidable terrible conditions, compounded by lack of access to preventative health services, education, or quality and compassionate care. However, with all I have learned in this epidemiology class, I am even more inspired to further educate myself in disease prevention and control. It has always been a great privilege learning and exchanging ideas with my classmates and the faculty through the discussion board and other media. The epidemiology issue of interest to me is the nosocomial infection, the high prevalence of nosocomial infections in healthcare facilities around the country and even around the world. I've always been interested in finding the best practices to reduce prevalence of nosocomial infections my whole nursing career because I have witnessed firsthand its impact on patients' overall health, recovery in the hospital or other healthcare settings, length of stay in such facilities, and the overall financial burden on both individual and the healthcare system in general. Nosocomial infection or health-associated infection appear in patients under medical care in the hospital or other healthcare settings, which was absent at the time of their admission. According to World Health Organization, it estimates that approximately 15% of all hospitalized patients suffer from these infections. This is quite significant. Common nosocomial infections include central line-associated infection, catheter-associated urinary tract infection, surgical site infection, ventilator-associated pneumonia. Nosocomial pathogens also may include bacterial, viruses, and even fungal parasites. Types of nosocomial infection, like I said, central line infection, surgical site, nosocomial pathogens, which are bacteria, viruses, and fungus. Epidemiology. According to the World Health Organization, 15% of patients are affected. This infection is also responsible for 4 to 56% death of neonates all around the world, 3 times more frequent in low-income countries than in higher-income countries. How do we prevent nosocomial infections? We can prevent this through prevention of environmental transmitted infections through air, food, or water, prevention of this infection through proper hand washing, and proper disposal of biohazardous materials. Control of nosocomial infections can be accomplished through infection control programs, immunization and vaccination, education and training on infection control policies and protocols, surveillance of nosocomial infections, which is also very important and can be achieved through collection of administrative data, demographic risk factors, patient history, test and test results completed on these patients. Conclusively, the increased burden of nosocomial infections and the antimicrobial resistance had made the task of eliminating nosocomial infections almost, if not impossible. However, with effective surveillance, adoption of evidence-based infection control protocols, and appropriate antibiotic usage, prevalence of nosocomial infection, I believe, can be significantly reduced. Thank you.